Okay, hello everyone. Thank you for joining us. I'm going to give everyone about a minute. Okay, my name is Allison, and I'd like to start off by welcoming all of you to today's event on behalf of the Brooklyn Public Library, New York Public Library, and Queens Public Library's Culture Pass program. I also want to thank our friends at the Brooklyn Historical Society for being here and putting this event together for all of us. If you aren't already familiar, Culture Pass is a program that allows active cardholders with all three of New York City's public library systems to reserve free passes to visit 75 participating cultural sites across the 5 boroughs. Our normal service has been suspended due to the temporary closure of these partner organizations because of COVID-19. So today's free public event is part of a special series taking place over the course of this summer, bringing the cultural life of our city right into your homes. You can find a full lineup of events at www.culturepass.nyc, and I encourage you all to check it out. There are going to be programs for kids, teens, adults, and the whole family. But before we dive into today's event, I do want to quickly thank our sponsors. Culture Pass is made possible through generous funding from the Stavros Niarchos Foundation, the Charles H. Rebson Foundation, and the New York Community Trust. And our virtual programming this summer is supported by a grant from the New York City Department of Cultural Affairs. And the libraries are truly grateful for all of this support. So with that, I'm going to hand it over to Deborah Schwartz, President and CEO of the Brooklyn Historical Society, and she'll be kicking things off for us today. So thank you for being here with us.
Welcome to you all. We're thrilled that so many of you have decided to join us for this incredibly interesting panel. We're going to talk a lot about collecting and very specifically about a particular set of initiatives around COVID-19 and an impulse to gather and collect in that context. As the president of the Brooklyn Historical Society, it is very much a part of, I think, all of our interests to understand that collecting historical materials is something that you're doing day in and day out, that what is for us here and now in the present will be history at some point in the future. And so that's a very key part of all of the impulses that you're going to hear about today. We have all, as New Yorkers, been grappling with this pandemic. It is not an easy thing on a personal level and on an institutional level. And so it is very wonderful to come together to think about these collecting initiatives when so much of our work otherwise has been curtailed. You're going to be learning about these initiatives led by the Brooklyn Public Library, the Queens Public Library, and their partners at the Queens College Library, as well as at the Brooklyn Historical Society. Each of these institutions has been actively soliciting materials that describe the lived experiences of all of us during COVID-19. Items include everything from oral histories to photographs, to materials like journals, lesson plans, grocery lists, masks, and we're going to hear a little bit about that. You're going to hear from each of the institutions, and just in terms of this actual program, you will, at the end of the program or anytime during the program, if you have questions, feel free to use the question tab in the GoToWebinar to just write out your questions. And at the end of the program, we will be happy to try to answer as many of those as we can. There are also some handouts that our guests have provided for us in the handout tab, and so you should feel free also to go in and explore those and download them if they interest you. So it is now my great pleasure to introduce our speakers. Let's begin with Jo-Ann Wong, who is the General Librarian at the Queens Public Library. Jo-Ann, welcome.
Hello and good afternoon. Thank you for inviting me to speak on this panel and looking forward to our discussion.
Thanks. and Obden Mondesir from the Queens College Library. He is the outreach archivist. Welcome, Obden.
Hi, thank you for having me here. Really excited to be a part of this discussion as well.
And Deborah Tint, who is the Special Collections Cataloguer at the Brooklyn Collection of the Brooklyn Public Library.
Thank you for having me. I'm excited.
And Virginia Marshall, Podcasting Associate at the Brooklyn Public Library.
Hi, everyone. Likewise, great to be here.
And my own colleagues at Brooklyn Historical Society, Anna Schwartz, who is our Collections Manager for Art and Artifacts. Welcome, Anna.
Hi, thank you for having me.
And Amy Lau, our Archivist at Brooklyn Historical Society.
Hi, everyone. I'm also excited to be here.
So before I'm going to turn it over to the panelists who have prepared some really interesting presentations for us, I just wanted to toss out to you a few sort of broad questions, which I know you have all been thinking about. In particular, sort of if you could talk a little bit about the goals for these projects and some of the challenges of the projects. And I'm wondering if somebody from Brooklyn Public Library would like to respond to those questions.
I can jump in on this one. The Brooklyn Public Library really wants to create a time capsule for this event so that we can understand what went on from the very grassroots perspective of different people, and also to give Brooklynites a voice that can be heard by their fellow Brooklynites and by the wider world.
Great. And challenges?
Challenges, I can talk about the cataloging challenges because that was my part of the job, but Virginia may have more to say about that.
I think just to jump in on the challenges part, I think one of the things we faced was what a lot of people are facing now is the gaps in technology and the ability to use technology to connect with people. So we had a lot of interest, but maybe coming up with an idea that was accessible to all, to people who didn't have internet access, as well as those who did, was one of our challenges.
Great, thank you. And Brooklyn Historical Society, goals and challenges?
I would say actually our goals and our challenges are kind of intertwined. Our goals shifted in the course of collecting material for this collection. We initially were really thinking about reaching out to different communities that have been underrepresented in our collections before. And in the course of collecting material, we were really aware of the fact that we were largely collecting material that had to do with trauma, because COVID-19 is a traumatic event. And so we had to take that into consideration going forward. So our goals shifted from perhaps reaching out to communities to really thinking about how we should in fact make an initial ask, but then since we had not perhaps had a historic relationship with different communities that were underrepresented in our collections, this is perhaps not the time to do that. So one of the challenges was being aware of the fact that there are certain archival silences in our collection and recognizing that, but also wanting to fill in those silences, and kind of really being aware of that in the course of putting out calls during this collecting initiative.
Thanks. It's really, really important point. And our colleagues in Queens, comments on goals and challenges?
So in terms of goals, one of the things we wanted to, as Brooklyn Historical Society and Brooklyn Public Library have said, is that we really wanted to really engage with our community and learn about what the experiences that they are having at this moment. And, you know, as we say, 2020 in itself is a very interesting year. and it's one I think that will go down in historical record. And as we say, you know, history, yes, it's in the textbooks, but the things that make history are people's stories and experiences. And especially with Queens, as Queens is getting really hit really bad with COVID-19, we thought it was important and very imperative that we save these stories, and then especially in terms of collecting diverse stories as well, that when we were collecting, we wanted, you know, people from all over Queens, because each community from Queens did get really affected by COVID-19. And so by collecting these stories, we can ensure that their story is also involved in the future tellings of when we talk about COVID-19. And so in terms of challenges, I think Obden might have a few words to say about that as well.
Yeah, so in regards to challenges, one of the challenges was like the ethical considerations of like rapidly collecting these interviews. So like getting consent was something that we thought was really important, and like having people listen to the interviews and agree, like, do you want this online? And like when people say no, it's just like, well, then can we create clips? And if they say yes, then we allow the clips. So that was one of the things that like was a challenge, just because like, you know, getting a signature was really hard early on, and figuring out how to do that, and using verbal agreements in combination with like written agreements was something that we worked on throughout the project.
Great, thank you. I think for our listeners, one of the things that's so striking is that all of you are thinking about these projects in, you know, kind of the terms that have you be the keepers of this information for the rest of the world moving forward. So you're thinking about things like, how do you make sure people agree to have you utilize these in the future? I'm going to guess that for a lot of our listeners, they've never even thought about things like that. So it's really interesting for people to appreciate kind of the subtleties and the complexities that you all face as archivists, as historians, as the people who are really in charge of sort of safekeeping of all of this for the future. And I hope that is of interest to our listeners. So with that, thank you for your answers. Let us get started with your presentations. I'm going to kick this over to the Queens Public Library and Queens College to begin. We're going to pull your presentation up here on the screen in just a second.
Okay.
Awesome. So to officially get started, as we mentioned earlier, my name is Jo-Ann Wong. I'm a general librarian from Queens Public Library, and I'm joined by my colleague Obden. We are from Queens Memory Project, specifically the COVID-19 project. And so Obden, take it away.
Yeah, next slide. So yes, hi, my name is Obden, work as the outreach archivist, and the Queens Memory, and initially the Queens Memory Project started in 2010 by Natalie Milbrook, who is the current director. And it started as a capstone project and evolved into a program that is at Queens Library and collaborates with Queens College on a regular basis, and has been collecting oral histories from Queens residents since 2010. When the crisis of COVID started and like we started going into lockdown, the decision to collect oral histories around COVID was a easy pivot that we decided to get into on April 9th. Next slide.
And so with this big project, we wanted as many people from the community to contribute. And so one of the major ways that we did so was using social media, specifically Instagram and Facebook, to get the word out. So using Instagram, what we did was we started with a 10-week campaign originally, but we're actually thinking of expanding now, of a series of prompts of what people could possibly submit, themes we were thinking about. In addition, on Instagram, as we're saying, our project was really invested in getting our community super involved. So we were asking a lot of people if they wanted to volunteer as part of our project via Instagram, and saying that if you want to join in, please do. We welcome everyone. You just have to send us a DM/direct message. Other ways that we did was also from the as we started receiving submissions, what we started doing was we started creating various forms of media to help promote and share kind of what are some highlights we're getting. So some of them include this short video series that we've been periodically putting out called Snapshots of Queens, where we highlight submissions that we've received. We also have a podcast. We had the first episode out, and that is going to turn into a 10-episode podcast. And the podcast is using a lot of the audio clips to shape the stories around those themes from that initial 10-week title card campaign from Instagram. Lastly, another way was using Facebook. We did hold a lot of public programming, which I will talk about a little bit later, but Facebook was also very integral of sharing and showing what we were doing. Also, our hashtag was #QueensCovid. So if you search for that on Instagram, you will definitely find us. Next slide.
Yeah, so I'm going to talk about how we gathered interviews. As I mentioned before, one of the challenges that we realized and addressed was gaining consent. So initially we had the verbal agreement through the interview as we were conducting the interview, but like later on would send a form that they would sign digitally and give instructions on how to do that. So we also did trainings for people on how to do remote interview collections, and like we evolved from using Squadcast, which allowed you to collect interviews in WAV format and also view the person, but there were some issues with that, so we also included using Google Voice and Zoom. Google Voice is a really great alternative just because there isn't much of a learning curve in regards to collecting the interviews, and this helps with the two approaches that we had, where we had both volunteers help collect interviews and oral history practitioners like myself and Lori Wallach. So for those that had issues with like, how does one use Squadcast or Zoom, there's Google Voice, where you press 4 and it records the interview, and was really an easy way to do this. Next slide. And in regards to highlights that we had during our interviews, there was Nicola Lucchi and Frank Wu. Nicola Lucchi is a professor of Italian languages at Queens College, and it was really great to interview him and talk about his experience of, one, learning about COVID from an earlier timeline, a non-American timeline, and also because he was from like the epicenter of the virus in Italy, which is in Lombardy, the region of Lombardy. Getting insight from that was really helpful in understanding like the global experience that is COVID. And the second person that we got to interview was our incoming president of Queens College, Frank Wu, who has an amazing background in civil rights law and activism, and really talked about its experience growing up in Detroit, Michigan as a Chinese American, and the importance of leadership during this time, and the plans and the things that he plans to do as Queens College president in helping people and guiding people during this pandemic. And these interviews really were really great, and led to the public programming that Jo-Ann will speak about. Next slide.
So in terms of public programming, so one question some people have is why are we having public programming for this collection and documentation project? And so part of it is public programming. As I said before, it's really helpful to get the word out, and it helps us to engage with different parts of the community that maybe did not see our initial campaign. You know, it's the more ways that you can get the word out, the better. And also public programming also allows us to engage with a more global and national audience versus, you know, just specifically Queens. By having these materials, we can share them out to, with the internet, the world is wide open. The world is your oyster, as they say. And so anyone can access these materials. So specifically for a good majority of our programming, we have been using Facebook Live. Specifically, we've been using it because we found it to be more accessible. You do not need to have an account to access it. And we have lots of platforms that are available, but Facebook is one that, regardless of the type of technology you have, it is the one that I think is the most accessible. In terms of the types of programs we've been doing, there are 3 types that we have been focused on. So the first one is this, we pre-record these interviews with local businesses, artists, and organizations. And they're called What Shapes Our Communities. So we talk to these individuals to talking about who they are, how they got started in Queens, and then also how they're adapting to COVID-19. Because especially like the local organizations, businesses, and artists, they've been really extremely affected by COVID-19. And so we're giving them kind of also adding their voice to the narrative of what they've been experiencing. Other things that we've been doing, as Obden mentioned, Frank Wu. Frank Wu actually participated in a panel we hosted called Minority versus COVID-19, Education Through Crisis for Asians in America. The reason why we were hosting this panel is that we realized that with COVID-19, besides the individual stories we were getting, COVID-19 has also shown a lot of structural inequalities that have been happening in many situations. And so this one was specifically about racism against Asians in America. And then, you know, we're also planning future panels. We have one that we're trying to plan called in relation to the immigrant experience and how they've been affected by COVID-19. And then we're working with Queens College Library so that we can also have a whole slate of programs in a similar nature for the upcoming fall. And so lastly, the last type of programming that we have is they're more community engaged programs. So for instance, we have My Shelter in Place karaoke playlist, where it's an open mic session. And so people can participate and kind of showcase some of the talents that they have from the comfort of their home. Other ways is we have a memory kaleidoscope game, which is a card game that kind of talks about the shared experiences of memories. And then we also have trivia night of How Well Do You Know Queens? And so all of these types of public programming have been really great because they get to share what we are doing as a whole project and as a whole organization. But because especially we have a lot of community engagement with these, we're also getting input from the community of what they're seeing when we host these public programming. Next slide. And so, you know, especially because we're archiving material, we also do want to have archived versions of a lot of our public programming that we are hosting. And so there are definitely tons of ways that you can access all of these materials. Anything that has been streamed on Facebook Live is available on our Queens Memory Facebook page. It's also available in the Queens Memory Video Archive, media archive called Aviary. From there, we have our panels, the My Shelter in Place karaoke, as well as the What Shapes Our Community. We also have the snapshots of Queens videos also uploaded in there as well. The only event that we don't record is the memory kaleidoscope and the trivia. And then in terms of also, you know, we are collecting oral histories, but we're also collecting images, videos, the whole scope of even written submissions. And so to do that, what we've been doing is having people submit through Urban Archive. And then Urban Archive has been amazing. And what they do is that they upload all these images, show them on the side panel, but then what happens is that they geolocate where each image or submission is coming from, so that at the end of this program, we should see like a huge, big map of where submissions are coming from. Next slide. So these are just some highlights from our collection that we've received. If you have any questions about these particular stories, please feel free to ask in the Q&A. But just from this slide, we have an artist, we have a nurse, we have a neighbor helping another neighbor, and we have a photographer who is contemplating what there is to photograph when there's no one on the street. So it's a very wide range of stories, but they're all coming from Queens, and it's been great to really see people sharing their personal experiences. Next slide.
I'm just giving you a little time warning, Jo-Ann.
Yeah. So perfectly just in time. These are our resources and related links. They should be available in the handout that you're seeing. Next slide. And feel free to contact us. We are always welcome to hear your thoughts and questions. Thank you very much.
That's great. Thank you both. It's really exciting and an amazing range of materials and programs. Fantastic. Congratulations. I am now going to turn this over to the Brooklyn Public Library for their presentation. Just let me pause to say that some of you are already sending us questions, which is fantastic, and we will save them for a Q&A session at the end. So, Deborah, take it away.
Okay. Well, we're both here. Virginia and I are here to talk about the Our Streets, Our Stories COVID-19 Stories collection. And we're going to start out with a few clips to demonstrate what those interviews are like. And that will be I believe, our next slide. Next slide to show.
Can you turn off your video?
There we go.
Great.
Okay. So, Virginia, would you like to begin?
Yeah, thanks so much. So we just wanted to highlight a few voices from our collection. So this first clip you're going to hear just 30 seconds from an interview that's probably 45 minutes long. This is Numa Menkiti. She's a resident of Kensington, Brooklyn, and she and her family contracted COVID-19 back in March. So you can play the clip and we'll listen to a little bit of what she had to say.
I just remember being so frantic, you know, because you walking out of the house and like saying goodbye to my children and wondering whether I would see them again. I remember I tried to write a version of a will on a piece of my journal because, you know, these weren't I'm 40, so I guess I really should have these things in place, but I don't.
So that was just one clip from one of our contributors, and we'll go to the next slide and we'll play one more just to show you sort of the range of voices that we've been collecting. And I should say also that our project focuses only on oral histories, so all of our stuff is audio related. So this is Christina Lee. She is a high school student who lives in Sunset Park, and she's been inside since March, at least at the time we talked to her back in May. She had not really left her apartment, but you could play the clip now and we'll listen to her speak.
I'm kind of like afraid in the sense that like the world has been like kind of saying that the reason why the pandemic is happening is because of like Asian Americans and not Asian. So I'm kind of worried that even if like we do return to normal, like when I'm able to go outside again, I'm kind of worried in the sense that like people might disrespect me or like look at me differently and kind of like try to blame the pandemic on me just because of my race, you know?
Thanks so much. So we just wanted to start out with the voices of the people who've contributed stories, but I'll turn it over to Deborah now to tell you more about the project as a whole.
So next slide. So Brooklyn Public Library's COVID-19 stories, which are audio interviews of the pandemic, as Virginia was saying, is the latest iteration of a long-standing project at the Brooklyn Public Library called Our Streets, Our Stories. This neighborhood community documentation project has been going on since 2014 and was inspired by the Queen's Memory Project, which you heard about a little bit earlier. Throughout the years, we have reached out to our patrons, usually by visiting library branches, to solicit material that tell the story of their lives past and present. In time, we have built up a varied collection of digital items. In addition to oral histories, we gathered family photographs and correspondence, family documents, ephemera, even photographed objects brought to us like t-shirts and pins. And on this slide, you can see some examples of some of the materials that came to us in these previous projects. Next slide. And, whoop, not quite, back up. Yes, okay, and this is how you would see these assets. These are the combined assets as they appear on our digital collections page, which I'll talk about later. It seems an unheard of luxury now to solicit patrons directly, receive materials, and interview them in person. But the disadvantage of social distancing during COVID also became this new project's strength. Having to push the word out electronically and being able to interview remotely gave us access to more people than we ever would have in a face-to-face context. In addition, the urgency of the event galvanized people to reach out and be heard. And now Virginia can tell you about assembling the team and the process of the COVID interviews. Next slide.
Thanks, Deborah. Yeah, so as Deborah was saying, we put out the call for COVID stories related to COVID-19 in Brooklyn in mid-April. And so this is just a picture of our oral histories page on our website. And you can see the call there, and we'll be sending along, actually it's in the chat now if you want to click into that and click around as we're speaking now. But basically we received a pretty intense response after first pushing it out on our social media and email pages. About 50 people the first day wrote in saying, hey, I have a story about COVID-19 in Brooklyn and I want to share it. And then about a dozen people reached out saying, I want to help out with this project. So immediately we found that there was an intense need to talk about what was going on in the borough. Like Queens, Brooklyn has been very impacted by the pandemic. There have been a lot of deaths, a lot of job loss, so sadness, but also our neighborhoods individually have been changing, and we wanted to capture that. So there was both a need to talk and a need to listen. So from there, my work, I usually produce the library's podcast, but in this new normal, I transitioned to working with Deborah and others at the Brooklyn Collection team to basically put volunteer interviewers and Brooklynites who wanted to share their story in touch virtually. So we could not have collected all the stories we have thus far, which is I think about 50. There's almost 40 on our map now, but we could not have done that without our volunteer interviewers. And those are just everyday Brooklynites, journalists or oral historians who volunteered their time to talk to their neighbors. So we can go to the next slide. Great, and I just wanted to point out that on this one web page, the link is in the chat, you can access both the map where you'll be able to hear all the oral histories across the entire Our Streets, Our Stories project, as well as the COVID-19 stories through the map. That's the first oval, and then the second oval below is our digital collections page, just another point to access the materials, and Deborah will be talking about that in a little bit. But you can go to the next slide. Great, so once you've clicked into our map, this is what you'll see. And the reason we decided to display all of the oral history content in this way is that Our Streets, Our Stories is a really neighborhood-specific oral history archive. So it started way back in 2014, and we talked mostly to older adults just about what they remember and how their neighborhoods have changed. So all of those are represented on this map, as well as the COVID-19 stories, which you can see highlighted in the featured collection. So if we go to the next slide, if you were to click on that Brooklyn COVID stories, you would see all the oral histories we've thus far processed. So you can see Christina Lee, who we heard from earlier. She is here on the page, as well as others who share their stories related to the pandemic. So you can go to the next slide. Great, and if you clicked on Christina Lee, this is what you would see. So you can play her full interview by clicking the bar at the bottom, or you could even click into specific points in that interview where, for example, she talks about her summer plans, or she talks about how her theater class has changed. And that's really important too, because people who are coming to this website can search for specific subject areas. So they could type in at that box at the top where it says COVID-19, they could say, hospital, like Brooklyn Hospital, and they could pull up all of the interviews where someone has talked about maybe receiving care at Brooklyn Hospital in different different neighborhoods, and interact with the archive that way. So you can go to the next slide. And another way to interact with this map is just as a map. So it's fully interactive. You can click on any of these neighborhoods and pull up stories from 2014 onwards about different neighbors just talking about their experiences here in Brooklyn. And there's also a drop-down menu, in that red oval. So now I'll hand it back to Deborah. You can go to the next slide.
Great. So now that Virginia has talked to you about the map interface, I would also like to say we have another portal to access these histories. And these two interfaces have different advantages. The map holds basic identifying metadata. It allows you to see the stories in the neighborhood spatial context, and allows you to click on a timestamp to advance through the interview. You can see here, there is another way to browse these stories, and it's from our digital collections page. So to go to this, you go to the Brooklyn homepage and you look for Brooklyn Collection. Next slide. And then you would choose Digital Collections. Next slide. And then you're going to come to our featured collections page. And if you scroll down, next slide, you will see that the Brooklyn COVID-19 Stories is there in its own discrete collection. So these are all interviews. And once you've opened this up, next slide, you'll have the option to choose one of these interviews at random, or as you can see on the top, there's an advanced search function, so you can filter your results according to keywords, subjects, and other criteria. So next slide. If you go into a record, I want to show you some of the extra information that we have in this portal. You can, of course, listen to the interview at the top. You can also download the file. This is also where you'll find information on how to cite this interview in case you want to refer to it or publish it. And I should say that all the materials in this collection are under the Creative Commons license. This is a license that allows you to use materials as long as you cite where you got it, and also to offer it in turn under the Creative Commons license. There are also subject headings to show you the top subjects that were touched on in the interview. And if you click on place, you'll see that there are 2 places listed. Next slide. That will bring you to all of the photographs in our collection that have that place listed. So you can see a snapshot of this neighborhood over time. And I hope the Culture Pass community will really enjoy these stories. And if you have any thoughts, please share them with us off our contact list. And now from this overview of the COVID collection, I will pass the baton to our next participant.
Thank you so much, Virginia and Deborah. That was fabulous. Much appreciated. We are, for the people here with us, we're running a little bit late. We hope you can stay with us past 1:30 so that we have a chance to respond to your questions after the presentation by Brooklyn Historical Society. So thanks. Welcome, Anna and Amy.
Hi, I'm Anna, and I'm here with my colleague Amy at Brooklyn Historical Society. Just really quickly, if you're not familiar with Brooklyn Historical Society, it's a history center located in Brooklyn Heights with a special collection library. We do public programming. So the BHS has traditionally had I would say a large or a long history of doing community-wide collecting initiatives, but I would say that we haven't, less so with rapid response collecting. So this initiative was really a response to the dramatic and unprecedented shifts in daily life that I think everyone was experiencing due to COVID-19, and really recognizing the importance of documenting and preserving how Brooklynites were impacted and are still being impacted by the virus, as well as how they responded to the crisis. In the very early days of this collecting initiative, it started more as a staff-led initiative. I think that was largely due to adjusting to remote work and not have capacity issues related to IT, trying to figure out quickly how to set up a digital submission platform. But as the crisis unfolded, it really became vital for us to create a comprehensive collection that reflected the myriad experiences of Brooklyn's diverse communities, and in particular, those communities that were most impacted. So I'm going to turn it over to my colleague, Amy, who's going to dive a little bit deeper into our processes and workflows. And we really hope that this can be useful to other small and medium-sized institutions that perhaps have limited resources, but are really interested in rapid response collecting.
Great. Thank you, Anna. Before I dive into kind of how our processing workflow works, I would first like to acknowledge, in particular, our colleagues Aliki, who is our project archivist, and Maggie, who's the manager of archives and special collections at BHS. Both of them worked very hard on this particular project, and this collection would not be processed to the extent it is without them. Maggie helped come up with our workflow, and Aliki has done all of the work in Past Perfect, which you will see very soon was a lot of work. So with that, next slide, please. VHS's COVID-19 collecting initiative went live at the end of April 2020. Our Programs and Communications Department sent out a call via our social media channels and email blasts, asking for people to share their stories and material that they have collected or created about the COVID-19 pandemic and how it has impacted their lives in Brooklyn. Next slide, please. People who were interested in donating digital content were directed to the online submission form, which is linked here on our webpage. Next slide. The link brings donors to our Google form, the initial page of which asks donors for their name, email address, and COVID-19 story. Subsequent pages allow donors to upload their digital file submission and provide location, date, and any additional information about their submission. Next slide, please. All of the information submitted via the Google form appears in this Google sheet, which is what I opened to review and rename submissions with subsequent object identifier numbers. For tracking purposes, object ID numbers are added to the end of the submission row on this form. Next slide, please. When donors submit files, they are uploaded to these folders in Google Drive. I download the files, rename them, and then upload them to a folder in Dropbox. All submission files are considered access files. Once all the images have been transferred to Dropbox, I delete all of the files in these folders. Next slide, please. I then email Anna asking her to create 72 DPI thumbnail files for all image files. Eventually, the thumbnail files will be attached to the image file records in PastPerfect. Anna then uploads the thumbnail files into the Dropbox folder and lets me know when she's done. Next slide, please. I then move the digital files to our server where they are permanently stored, and here's an image of what that server looks like. Next slide, please. Aliki creates image records for PastPerfect from the information on the Google submission form sheet. She reformats the information and puts it into this Google sheet, which is then converted to an Excel spreadsheet and imported into PastPerfect. Next slide, please. After the import, Aliki manually adds description fields that require greater description, the thumbnail image, and the finding aid link to each record. Next slide, please. And what we're looking at here is PastPerfect. So this is what a record looks like in PastPerfect, which is the back end of our record creation system. After Aliki created over 50 image records in PastPerfect, Maggie would review the records, these individual records, and then publish them via PastPerfect Online. Okay, next slide, please. I then created the finding aid for the collection in ArchivesSpace, and after Maggie reviewed it, I published it via NYU Publisher. Next slide, please. This screenshot shows what the PastPerfect image record looks like via the PastPerfect Online portal, which is what you see when you come to our webpage and you go down to photographs, you click on photographs, and then you have search options. So if you were just search for COVID-19 there, this is how the records would pop up. We currently have 59 published records for the COVID-19 collection. Next slide, please. Here's what an individual record looks like via the online image database. So this is what you would see. Next slide, please. Here's how the thumbnail image displays in PastPerfect Online. Next slide, please. If you close the thumbnail image and scroll down the page, you'll see the collection finding aid field, which displays the link to the finding aid. And if you were to click on that, next slide, please. This is what you would see. It takes you to the published finding aid, and this is what it looks like. In the future, we will normalize all submitted files and create preservation copies of those files, and those would also go into our permanent storage server. Next slide, please. Here's some examples of image submissions that we have in the collection. As you can see, the image on the left, there were a lot of images submitted that showed people wearing masks and social distancing. In May, we coordinated with our programming and communications department to send out a call for images of Brooklyn residents living life inside during the pandemic, and the result of that is on the right. You can see this is an image of mask making material and somebody's mask making setup. And with that, I will turn it over to Anna.
Yeah, so the first phase of this was really collecting digital material, so photographs as well as video and audio clips, although I think primarily we got mainly photographs of people's neighborhoods and of people's social distancing and we got a lot of chalk drawings, which is great. And but we really want to make sure that we build out the collection more. So this next phase that we're focusing on is collecting physical material and objects. And you can see this is just a couple suggestions of things that we're looking for. We're really looking for objects that reflect the health, economic, social, political, and religious impacts of COVID-19 in Brooklyn. So, for example, behavioral and cognitive impacts such as social distancing, romance and dating, pet adoption, as well as, instances of racism or xenophobia that we witnessed. So, economic impacts related to business closures, businesses shifting to production to address shortages of PPE. So largely what's happening in the Navy Yard, places like Kings County Distillery that's shifted from making whiskey to 70% alcohol as a disinfectant. Also material related to rent strikes, eviction, obviously healthcare related material and objects, education, remote learning, so lessons planned. How did students and parents shift to grapple with working or learning remotely and managing and balancing those things, responses by or lack of responses by city and state officials, and and then also religious impacts. What I think was really interesting is right when the shutdown happened, it was sort of when the three monotheistic religions were observing major holidays. So this has happened during Ramadan, this happened during Passover and Easter, and how did Brooklynites adjust their religious practices to this shutdown and social distancing and not being near loved ones, when also these holidays are really about being with the community and being with family. So we are really encourage people. The next slide, please. So we're still closed, but we really encourage people to submit a photo of the object that you're interested in donating or the material that you're interested in donating, and a brief description describing a little bit more information. If you want to donate a homemade mask, just giving us a little bit more information about that mask, and you can send all that to library@brooklynhistory.org.
Thank you so much. That was great. All of our panelists, it was incredibly interesting to hear both the similarities and the differences in the way you've approached this. I'm going to ask all the panelists to turn on their video and audio again, and I'm going to use the last 10 minutes or so, and if we run over a little bit, everybody I'm sure will forgive us, to take some questions. There's some great questions that people have been putting into the chat. So let me just jump in there, and I will see if we can get some answers here. Julie asks, she would like to hear about how taking audio and video stories how you're navigating privacy issues, and in particular issues having to do with medical information. Did anybody run into that issue as you've been collecting thus far?
I can speak a little bit to sort of the extra precautions we're taking right now in terms of privacy. Usually, as Deborah mentioned earlier, we operate under a Creative Commons license, and we always give speakers the opportunity to say, after they give their interview, hey, I'm not comfortable with this, don't put this anywhere, don't put it into the archive. And that's something that we have continued. We're taking an extra step right now in that we send the full audio file back to the participant. After getting verbal consent, we then get second verbal consent once they listen through to their oral history, and they're allowed to take out anything that it could be of concern. And then I think just in my own interviews that I've conducted and in speaking with Deborah and the other Brooklyn Collection staff, sometimes I have highlighted something that, hey, I think this might be sensitive information. I might send that back in the email to the participant saying, like, just make sure you listen at 10 minutes and make sure that's okay to publish. And as long as they say okay, then we're trusting the interviewee that they want that out there. So yeah.
Great. Thank you. Anybody else have a comment about that? Okay, great. This is the next question is getting more and more from Susan, who seems to have been involved in a similar project of collecting oral histories and other collecting around COVID-19, and noticed that she was getting much more active participation at the beginning when the impact seemed to be much more intense, and that's been sort of lightening as we go along, even though we're all still grappling with the virus, and wondered if any of you had comments about that.
I can speak a little bit to that. I think what's important is that regardless of how much flow, whether it's high or low submissions you're getting, what's important is that that we're sharing these stories as well. We are archiving them, but we also do want people to know about these experiences, of course, with the creator's consent, about what is happening. And so I think this is also kind of going back to that public programming, is like you can always generate interest with consistently pushing out your social media campaigns, consistently pushing out public programming, because, you know, at the end of the day, you know, we want people to learn about the project, we want people to submit, but we also want people to be aware that we have these assets. We don't want to be a silo where we take everything and then no one sees it again. We want people to consistently submit, but also be aware and know of it and learn from these stories that we are collecting from.
Great. I noticed there's another question later in the questions about will there be a time frame for this? Will you stop collecting around COVID at some particular point?
I'm good. Oh, okay.
No, go ahead, Deborah.
Well, I was just going to take a stab at it. I think that this, Virginia also can address this, but the Our Streets, Our Stories project is an ongoing thing. So if people, you know, want to dial in and talk about this even months after the event and things have changed completely, that will just be folded in with the, you know, with the material. So there, for us, there doesn't have to be a time limit. That may be different with different institutions.
Yeah, I think for us, that's something that we're still figuring out. We know people are still in crisis. This virus, this pandemic is still present, and there's a lot of up and down. So figuring out, you know, when the end date is tricky, and we're having those conversations with staff. And I mean, I imagine that we will continue to collect. I mean, there's just so much unknown in the future.
Thanks. Jo-Ann, did you want to add anything?
We're in the same boat as everyone else. Obden, if you want to share your thoughts on that as well.
Yeah, what I wanted to mention that that in regards to timeframes, I think it's a little fascinating because like even when this ends, there's going to be a long time period where people will need to like reflect on it. What I've found interesting, like the difference between interviewing someone in March and interviewing someone in now, that like someone has had time to reflect, like all these things have happened, and while there seems to be a wane in the intensity, at least in New York, of the experience, like there's so many things to reflect on. So like I think because this is like a global experience, the only thing I could compare it to right now is the to 9/11 and like the oral history project around that, where like at Columbia, even after it happened in 2001, like they were still collecting interviews 2 years afterwards. So I could imagine that there would be a similar timeline like that, where people will like even 2 years from now or from next February would still be talking about this or want to. Yeah.
Yeah, and people's perspectives on it will change and evolve. Absolutely. Thanks. Next question from Amy or Amy. Do any of these collecting organizations offer workshops for their volunteers or general public on how to do a good interview or on oral history techniques?
Yeah, just to speak briefly, Brooklyn Public Library, I've been onboarding, I guess, a lot of volunteers. So you'll probably be speaking with me when we talk through like how to use the technology and also the ethics of doing oral history interviews. It's pretty informal, but we do make sure, or I do make sure to connect with all of our volunteers to make sure we're all on the same page.
And when we did this, we did a recording of that whole process. So, you know, if people come in, you know, here and there, we have those materials to just like get them on board quickly.
Nice. Anybody else?
I know
Yeah.
for Queen's memory. Oh, did
You got it. You got it.
So for Queen's memory, we do have Meryl Gee. She's been really active in getting people to volunteer to be interviewers, and then she has also held multiple workshops for interviewers. She does them in sets, and I know that also we have, in addition to having these workshops, we have Google Documents for people, so that, you know, because especially we do want to have some consistency in questions that we're asking. Even for the ones that we're streaming for the public, there are some questions that are consistent with the oral histories that we are collecting. And so we have that available for people to take a look at. And so we try to provide as much support as we can to our interviewers, because, you know, they're giving us their time, so we want to make it as smooth a process as possible for them.
Great. I'm going to jump into a couple of questions about the maps. This clearly resonated for people. So there was a question about the Urban Archive map, how, you know, the map powered by Urban Archive, and then another question from Travis about partly about mapping and partly about whether people are concerned somehow that the information that you're giving people about where the interviews are taken, et cetera, is revealing too much information or overexposing people, whether there's any concern about, you know, conveying too much information. I think those are two separate questions, but they were both prompted by seeing how the specificity of where people are living or giving you those oral histories are coming from.
I'm going to talk just briefly about that because since I'm doing the cataloging, like sometimes an actual cross street will come up in the interview, and I figure, okay, that's part of the audio, but I don't have to put that in the summary. I don't have to have that, you know, traceable text-wise. So I know that the information is there and the person was okay with it being there, but it's not like I'm drawing attention to it. It's just a very small decision. But mostly it's just neighborhoods. Mostly we just locate it with the neighborhood.
Anything else about the mapping? Oh, sorry, Virginia, go ahead.
Oh yeah, and I was just going to jump in. Another interesting thing is that often people, because Brooklyn, like people move around Brooklyn all the time, so in their oral history they might talk about Canarsie and East New York and Williamsburg, and so sometimes we do place it in 3 neighborhoods, so you can access, because people are probably clicking through the map saying like, oh, I want to hear something about Williamsburg, and then coming up with that oral history. So they can appear in multiple neighborhoods, and like Deborah said, it's not giving anyone an address. But because our oral history archive as a whole is really focused on capturing neighborhood what's going on in the neighborhood at a local level, even down to the block. We do think it's important to show them that way.
Great. Tamar asks a question about pictures of physical evidence, in particular in Queens, but I think that's probably a good question to ask all of you, is, you know, what are the things that you are all really eager to see come into your collecting projects that you maybe that you haven't seen as much of, that you're, you know, eager to have people contribute to you?
I know for myself, in terms of kind of submissions that we've been getting, I mean, I think the great part about, you know, making this as community active as possible and being open to all kind of stories is that we really do see a really wide range of stories. And so I think the best part is when you start seeing you see stories that, like Obden had mentioned before, like we had a story where there was a nurse, she submitted a video from March and her experiences, and then she submitted one in May. And it was like a May update. And in some way, even though I've never met her, there was a moment where I was like, I'm glad you're okay. And so there's like those types of moments. And so I think what we really want to see is just continuing to see your daily life in your submissions, because I think we can all agree is that, you know, the daily experiences that we are having, they're super important. And, you know, it's those individual small experiences that create that bigger picture. So we're kind of more of just, you know, keep sending in your stories, because everyone, at least for me, when I'm looking at it, every story has been super fascinating just to see someone else's perspective in different neighborhood, or even in my neighborhood. It's those different perspectives that I like to see of just daily life of what is happening.
Great. Anybody else? Okay, I've got some other great questions here. Here's a question from Cheryl, who's asking specifically Brooklyn Historical Society. She had a poem published in a local paper, and she wants to know if she needs permission from the paper before sending it to us.
I guess I would ask, did the paper commission her? I mean, if she is the copyright holder and hasn't signed over any rights to it, then I would assume that it would be fine to share it with us.
Okay, so it may also make sense for her to get in touch with you directly.
Absolutely, yeah.
And talk about the details of it.
Yeah, we can.
Great.
Yeah, absolutely.
Okay. A question from Philip. Can any of the presenters talk about how the work they are doing might speak to loss and grieving at a time when lockdown and isolation prevents our working through this communal experience?
I know for myself, watching a lot of the videos, there are moments, I think, because especially, you know, we're working from home. So, you know, 8 hours a day, we're going through this material. Sometimes you do need to take a moment to take a breather and walk away. There were some stories like I had to take a moment away from my computer, because it is very heartbreaking to hear. Like, yes, there are stories of joy and hope, but there are a lot of stories of people who have lost family, nurses who are dealing with trauma. And I think that's something that we really have to address, is the mental health of our communities, and as well as, you know, our essential workers. For myself, seeing just as an observer, it's already very, very difficult. So I can only imagine what those people who are sending in those stories, you know, there's a lot of trauma that's happening, and we have to be respectful of that. But it's also, I think, important to document that side of the story as well.
Yeah, And I think just to jump in on that, Jo-Ann, and I really, that resonated with me what you were saying, just about there being moments of joy and hope, but also a lot of tragedy. There are a lot of people who've lost loved ones or are going through traumatic things outside of death, as the question was referring to. And I think personally, so a lot of the people who have been volunteering have also been suggesting people to interview. So often that's, you know, someone they know from their neighborhood or through an organization. And so when they are connecting with those people during the interview, they already have some relationship or background. And I think that helps too when talking about really challenging things. I talked to my cousin who's treating COVID patients in Brooklyn, and she was going through a lot of trauma too. A lot of mental health things were coming up for her, but because we knew each other and could take care of each other after the interview, I think that really helped. And I think there have been a number of volunteer interviewers who have had that experience as well. But I think it is really important to know that this is an extremely sad and stressful time for a lot of people. And as you said, Jo-Ann, it's important to document it, but also important to take care of each other. So.
And I just wanted to say as I'm cataloging these things and I'm reading through them, like there are people who give a tribute to somebody that they've lost, and it's one place where that person's memory can live and it's going to be there forever. And I think that can be satisfying, emotionally supportive of the people who are telling the story.
Thank you. I think we have to leave it here. We're over time at this point, but I want to first and foremost thank all of you for the incredibly good work you've been doing on this and the important work, and also for taking the time to do this discussion today. It was really wonderful to hear from all of you. Much appreciated. I want to join with my colleague Natiba, who left a comment thanking also not only all of you, but Culture Pass for providing us with this forum. And finally, I really want to encourage everybody who's listening to consider contributing to these collections. I hope you all come away with a sense of how important your voices, the evidence of your experiences are to all of these institutions. So thank you all so much for joining us today.
And thank you, Deborah. Thank you to all the institutions for working on this together with us at Culture Pass. And I just want to remind everyone that we have a lot more programs that are very interesting for all ages. So please visit the Culture Pass website. So thank you again.
Thanks all.
Thank you.
Thank you. Thank you.